Welcome to today's lecture on the topic of fructose and galactose metabolism disorders. In this comprehensive script, we will delve into the intricacies of various conditions associated with fructose and galactose intolerance. We will explore the biochemical pathways involved, the specific genetic defects underlying these disorders, as well as the clinical presentations and potential treatments. So let's begin our journey into the fascinating world of fructose and galactose metabolism disorders. Fructose intolerance refers to the inability to metabolize fructose effectively, resulting in its accumulation in the blood and tissues. The primary cause of this disorder is deficient levels of fructose 1-phosphate aldolase B, enzyme activity. Without aldolase B, fructose cannot be adequately broken down into glycolytic intermediates, leading to its toxic buildup. Symptoms of fructose intolerance include bloating, diarrhea, and abdominal pain. Essential fructosuria is a benign condition characterized by fructose appearing in the urine but without any clinical symptoms. The defect lies in fructokinase, an enzyme responsible for phosphorylating fructose to fructose 1-phosphate. Individuals with essential fructosuria are unable to convert fructose into fructose 1-phosphate, resulting in the excretion of fructose in the urine. Hereditary fructosemia, also known as hereditary fructose intolerance, is a potentially life-threatening disorder caused by a deficiency in aldolase B enzyme activity. When individuals with hereditary fructosemia consume fructose or sucrose, toxic intermediates accumulate, leading to severe hypoglycemia, hepatomegaly, and even renal failure if left untreated. Eliminating dietary fructose and sucrose is crucial for managing this condition. Galactosemia is an autosomal recessive disorder characterized by the inability to metabolize galactose, a component of lactose, due to the deficiency of different enzymes involved in galactose metabolism. Three common forms of galactosemia include deficiencies in galactose 1-phosphate uridyl-transferase, GALT, galactokinase, and UDP galactose 4-epimerase, GALE. GALT deficiency is the most common cause of galactosemia. Without functional GALT, galactose 1-phosphate accumulates, leading to hepatomegaly, intellectual disability, and failure to thrive. A strict lactose-free, galactose-free diet is necessary to prevent long-term complications. Infants with galactosemia, particularly those with GALT deficiency or epimerase deficiencies, are prone to developing cataracts. The accumulation of galactitol, a sugar alcohol formed during galactose metabolism, contributes to the development of cataracts. Epimerase deficiencies, referring to the deficiencies of UDP galactose 4-epimerase, GALE, result in the buildup of UDP galactose and a decreased level of UDP glucose. This imbalance impacts glycosylation processes and affects various tissues, leading to clinical manifestations such as liver dysfunction and developmental delays. Fructose 1,6-bisphosphatase, FBPase, deficiency is a rare disorder that affects gluconeogenesis. Individuals with FBPase deficiency experience fasting hypoglycemia, metabolic acidosis, hepatomegaly, and impaired growth. Prompt intervention with dietary modifications and glucose supplementation is crucial for managing this condition. Galactose plays a crucial role in brain development and myelination. Galactose 1-phosphate, derived from galactose metabolism, contributes to the synthesis of glycolipids and glycoproteins, essential components of neuronal membranes. Disrupting galactose metabolism during critical periods of brain development can lead to neurodevelopmental issues. Galactose, as a component of lactose, can be indigestible for individuals with lactose intolerance. Lactose intolerance occurs due to insufficient lactase enzyme activity, leading to gastrointestinal symptoms like bloating, flatulence, and diarrhea upon lactose consumption. Differentiate galactosemia from lactose intolerance in clinical practice is vital to prevent misdiagnosis and provide appropriate dietary guidance. Galactokinase deficiency is a rare autosomal recessive disorder where individuals lack the enzyme galactokinase, essential for phosphorylating galactose to galactose 1-phosphate. As a result, galactose accumulates in the blood, leading to the development of cataracts, which may be the prominent clinical manifestation. Understanding the molecular characterization of fructose and galactose transporters is vital for comprehending their role in cellular metabolism. Specific transporters, such as GLUT5 for fructose and SGLT1/SGLT3 for galactose, ensure the efficient uptake of these sugars into cells for subsequent metabolism. In conclusion, fructose and galactose metabolism disorders encompass a wide range of conditions with varying clinical presentations and underlying genetic defects. Understanding these disorders at a biochemical level is crucial for early diagnosis and effective management strategies. By elucidating the intricacies of fructose and galactose metabolism, we pave the way for further research and potential therapeutic interventions in the future. Thank you for your attention throughout this comprehensive lecture on fructose and galactose metabolism disorders. Feel free to reach out with any questions.